It's kind of cliched, but I actually wanted to be a doctor almost my entire life. My mom tells me stories of when I was about 6 years old, already expressing interest in being a physician. At that time, I didn't really understand what it meant, but I kind of wanted to be on that track. You know, I like the science, the biology, the helping, the entire nature of the field. So that's kind of when it started, and I never really deterred from that my entire life. That's kind of what I wanted to do, and that's where I am now. I think it's important to have family around, especially when you're making bigger decisions, sometimes involving surgeries or a big treatment plan. It's sometimes difficult to make those decisions by yourself because the implications don't affect you as a patient only, it affects the entire family who are taking care of you and what's going to happen in the future, and it helps to have your loved ones around you to help you make that decision. I think for both sides, both myself and with the patient, you have to be very honest and truthful, especially in my field. And I would say in any field for that fact, the more honest you are and the more open you are about what's going on and truthfully stating, what symptoms you're having or what you're doing necessarily that may be making it worse or better and so forth, really helps me find out what is the best way to make things better. And on the flip side, I will be as honest as possible with you to let you know, what are the chances that we can make a difference, what is the chance that we can make this better, and what are the risks and benefits and so forth. My favorite things, I think, on the technology aspect, I very much like computers. I build them and I do programming with them and such, and it's become kind of a hobby of mine. As far as things outside, I really have gotten into scuba diving and snowboarding as my two kind of outdoor hobbies that I enjoy the most. But just about anything outside I enjoy. And recently, I've always liked to draw and sketch, and recently I've got into medical illustration, which I've been doing quite a bit. Generally, there's a good fit for different types of people, and some people work better with someone who's straight to the point, and some people work better with people who like to talk a lot and have a big discussion, and to each their own. But I think the ultimate thing that unifies everybody is you have to have trust. You have to have trust in your physician, and your physician has to trust you.